Welcome to the Clear Gun Show. I'm your host, Dr. G, with a PhD. Because it's the day ending in Y, we've got some news to break down for you guys. We're going to spend the first half of the show talking about the new YouTube guidelines surrounding COVID-19, what we had to deal with before last week, and what we have to deal with moving towards the future. It's pretty interesting, and it's going to be a behind-the-scenes look at what people that publish content on COVID on YouTube have to deal with to publish. So I hope you guys enjoy that. We're also going to talk a little bit about Fauci. We'll discuss 2 COVID lawsuits. We'll talk about climate change and obesity. And finally, should we eat bugs to save the environment? All that and much more in today's episode. Let's dive on in. All right, so for starters, I don't know if you guys know this, but sometimes we post controversial or counter-current ideas, especially about COVID, on this channel. It has, on more than one occasion, gotten us in a little bit of hot water with the YouTube overlords. Now, of course, we don't do this flippantly, and as anybody knows who watches this show regularly, we cite all of our sources, and our predictions are made based on a combination of using our sources from usually pretty highly regarded journals, and our common sense and our critical thinking. So it's a combination of those three. And not to put too fine of a point on it, but we've been right about a lot of stuff. Well, it just so happens that last week, YouTube changed their COVID policy on misinformation. Looking through these differences, and we're going to show you them here on screen, there was 6 major differences, 2 of which dealing with ivermectin, 1 on social distancing, 1 on mask policy, 1 discussing the difference between COVID and flu, and then finally 1 discussing vaccine and then the risk of COVID after having vaccine. The first change comes at the very beginning of the document, and I'm going to read you the guidelines before and then the guidelines currently. So in the before category, claims that ivermectin and hydroxychloroquine are safe to use in the treatment of COVID-19. That was the claim you couldn't make in the guidelines prior to last week. The current guidelines claim that ivermectin and hydroxychloroquine are safe to use in the prevention of COVID-19. So before briefly discussing this, I'm going to show you guys the guidelines where they mention ivermectin again and they changed the rules again just so we can see them in both places. This is part of the prevention and misinformation section, and here again the claim is the same. Claims that ivermectin and hydroxychloroquine are safe to use in the treatment of COVID-19, that was the before. Now the after, which is the current guidelines, claims that ivermectin and hydroxychloroquine are safe to use in the prevention of COVID-19. Now way back in September of 2021, I posted a video. Now, I didn't post it actually on YouTube because it would have just been taken down immediately. But I posted a whole video, it was like 20 minutes long, defending Joe Rogan's use of ivermectin against COVID-19 as a treatment. And his doctor prescribed it, and we went through all the literature and all the data. We knew a lot about ivermectin then. We know a lot about it now. It's a very old drug. It has a very safe profile, and it seemed to be doing some good in treating COVID. So Joe Rogan took it and everyone gave him flack, and I defended him pretty staunchly on this show. Then the FDA released tweets like this, which were just totally crazy. And it pretty much turned everyone away from ivermectin, or not everyone, but the public away from ivermectin as a viable treatment for COVID-19. Why has YouTube changed their guidance policies? Because a bunch of literature has come out showing that it is in fact pretty good in combating COVID-19, especially if you're able to show you have COVID-19 early on. The earlier you use ivermectin, the much more effective it is in your treatment of COVID-19. In the same section of prevention, in the old guidelines, they had this. Claims that COVID-19 vaccines do not reduce risk of contracting COVID-19. That was the before. Here's the after. Claims that COVID-19 vaccines do not reduce risk of serious illness or death. Now, I showed the clips even just last week of how many times people said, yeah, once you get the vaccine, you are not going to get COVID. So I'm not going to show that again. But you guys know it was supposed to be common information from every single, leader in public health. Even the president was saying, if you get the vaccine, you're not going to get COVID-19. Obviously, that was incorrect. We've been staying on the show for a long time. As a matter of fact, 2 of our episodes got warnings or notifications that I had to contest based on the results and the science surrounding the COVID-19 vaccine. Also in prevention, now this was totally removed, but in the prevention misinformation section of the guidance in the before, they had 2 claims right here back to back. Claims that wearing a mask is dangerous or causes negative physical health effects, and claims that masks do not play a role in preventing the contraction or transmission of COVID-19. Here's that exact same section in the current guidelines, and as you can see, all the mask claims are out. Like many problems with the COVID-19 response, the way that they handled masks, and when I say they, I mean the leadership in public health, the way that they managed masks was just terrible and was bound to fail. Dr. Fauci definitely had it right in the very, very, very beginning when he was telling everyone not to go out and get masks. Now, 3 weeks after he said that, and the Surgeon General corroborated with him, if you recall, they said, no, we said that to protect our doctors so they could get the masks because everybody was buying masks. But Fauci was right, and he gave the correct reason, because these viruses are way too small, that the average mask, the average gaiter, the average bandana, the virus is going to pass through the threads that create that mask. So it does effectively nothing. That didn't stop just about every public health official and several medical doctors in the community from advocating for covering your face with anything and everything possible. As long as your mouth is covered, we're going to stop this virus.
You know, Mady, instead of worrying about what kind of mask, just wear a mask. Wear a mask. You know, wear a surgical mask, a cloth mask. Some people can't tolerate N95s. Rather than saying one versus the other, we need to wear masks.
That was basically the messaging. And what I think should have happened was people should have said, okay, well, why these masks? What's the size of the virus? Do these masks actually prevent anything? But there was no nuance, no discussion to be had, and all these questions were answerable at the very beginning of the outbreak. We know the size of COVID particle because we've studied COVIDs and coronaviruses in general for a long time. We know the size of masks and threads. We know the different thread sizes and counts for shirts and how they're stitched together. We know all these things, and all these questions could have been asked, and none of them were. Or if they were, it was totally thrown to the wayside. As a matter of fact, in May of 2021, when Texas and several other states were starting to say, we do not want to force people to wear masks, I wrote an essay defending that policy based on evidence. And I'll send you guys, I'll put the link in the description. You guys can go read it if you want. But even May of 2021 was relatively late as far as when we knew what we knew and what we could have said and asked questions about of the masks. So moving on to the fifth big change, this was in the transmission misinformation section. In the before guidelines, they had a social distancing section, and it said this: social distancing and self-isolation misinformation. Content that disputes the efficacy of local health authorities or WHO's guidance on physical distancing or self-isolation measures to reduce transmission of COVID-19. Now here are the current guidelines. Nothing on social distancing. This was always kind of a hilarious notion to me just because it removes any understanding of basic circulation and airflow in general. So, you would see people walk into restaurants and there would be these signs on the floor and in stores and they would say go in one direction, or you can sit here and here and here, and you can only take your mask off once you get to the tables, and the tables are distanced enough that the virus, can't make that jump or something. When in reality, almost all these restaurants and all these stores have recirculated air. People are breathing all the time with different breathing rate. There's just so many factors that social distancing really doesn't matter with a highly contagious airborne virus. It just really doesn't. But again, even though the data had been there the entire time of COVID, if I had said this 2 weeks ago, I would have gotten a strike on my YouTube channel. The last major change that comes in the guidelines is in the section of content that denies the existence of COVID-19. So more than 2 weeks ago, you would have been flagged for saying the following: claims that the virus no longer exists or that the pandemic is over, and claims that the symptoms, death rates, or contagiousness of COVID-19 are less severe or equally as severe as the common cold or seasonal flu. So in the old guidelines, the fact that they had claims that the virus no longer exists or the pandemic is over is a huge range. In the current guidelines, they just have denial that COVID-19 exists. The claim that the pandemic is over, you weren't able to make that, was insane because of how they had defined the pandemic. It just kept changing. The definition was ever morphing to whatever Dr. Fauci basically had to say about it. I think even right now we're still in an emergency, according to the White House. So it's great that they removed that, and finally. Now, as far as the flu comparison and the common cold comparison, in the current guidelines, they say you cannot claim that the death rate of COVID-19 is equal to or less than that of the common cold or the seasonal flu. We'll see how long that takes to change, especially as data comes out and how they define or how they redefine dying from and with COVID. I suspect that guideline will change. And then the final guideline that they changed was claims that COVID-19 are equal to or less transmissible than the common cold or seasonal flu. Yeah, there's probably a good reason. I mean, you should be able to say whatever you want, but I think a lot of actually data-driven channels are going to say that, yeah, it's very transmissible. So that is in the guidelines. I don't see why it's in the guidelines, but it is. So that's a little behind the scenes about what people like me that post things on YouTube that are true about COVID kind of have to deal with and navigate around. With that being said, one of my most popular episodes on the Vaccine Adverse Event Reporting System, VAERS, was never allowed to see the light of day on YouTube. As a matter of fact, I got a warning. My channel's only warning is the only one I failed to contest, and it's on Rumble right now. One of my most popular episodes, and we break down the entirety of VAERS, what VAERS says about the vaccine and the data with young people, old people, everybody in between. It's a really great episode, and we'll see how long it takes for YouTube to change their guidelines on what you can discuss on the vaccine in terms of VAERS. As you know, one of the main missions of this show is to bring about reasonable conversation. One of the best ways to do that is to tell the truth. If you have a foundation of truth, then you can have a very reasonable conversation on just about anything. And we try to do that here on this show. And if YouTube wants to challenge us, we'll fight those challenges. If YouTube wants to ban us, we'll go somewhere else. But one thing I can guarantee you on this show is that you're always going to get the truth, and you're always going to get the most up-to-date science with all the sources so you can make your own decisions and have reasonable discussions with your friends and family. All right, moving on to some news that happened last week. We will start with the benevolent leader, Anthony Fauci, and his statements on being flexible on MSNBC.
It's going. Because we'd been fooled before. We didn't fully appreciate the magnitude of HIV back in the early 80s when I first got involved, when the first cases were recognized. And there were so many things we learned on the run with COVID. I mean, the things that we thought we knew in the beginning turned out as the months went by to not be the case, which really forced us to adapt and to change some of our policies and recommendations. That was interpreted by many as flip-flopping or not really knowing what's going on, when it really was the evolution of the science. So one of the lessons that I hope we learn is that we've got to be prepared, we've got to be able to respond, but we've also got to be flexible.
What he conveniently leaves out, and what so many in the public health leadership continue to leave out, isn't the fact that people don't understand the quote-unquote flip-flopping. What they do. It's not that they don't understand that science, you learn more in the process of doing science, which people do understand that. What people hate him for, and a lot of the public health sector in general, is the fact that based on limited evidence, and by limited I mean they had limited themselves because there was a wealth of evidence suggesting otherwise. Based on limited evidence, they forced people to take a vaccine, for example, that they didn't want, or else they would get fired. You had to wear masks in different places or you couldn't go in. Your kids had to go to school remotely. It was those kinds of actions with little evidence that people were forced to do that all of a sudden, 10 months later, they say, oh yeah, we got that wrong. Oh well, no problem. That's what people hate him for. He's not admitting it. No one's admitting it. And that's one of the biggest problems public health has right now. The same day that this recording with Dr. Fauci and MSNBC was released, which was August 22nd, a bigger and much more relevant story broke. Let's see how the American public reacted.
We have breaking news from the White House. Dr. Anthony Fauci is retiring.
I mean, honestly, what else were you expecting? That's the exact kind of reaction that I think we all had. So that is the breaking news. Anthony Fauci did put in his resignation for December of 2022. So before the Biden administration wraps up. I, for one, am not going to miss him, and hopefully his replacement is a much better public health leader. Of course, Fauci isn't the only one discussing after the fact, after all the damage is done, oh, hey, we might have gotten things wrong. Let's hear what Governor Hochul from New York has to say.
And the decisions were made to have all the kids go home and learn remotely. Wow. Wow. What a mistake that was.
What a mistake that was. Yeah, gee, you think? And the thing is, nobody had a choice. Nobody was even allowed to present or discuss a reasonable opposition to that move. So thank you guys for recognizing how big of a mistake it was after all the damage is done. That's what we always like to see. A couple of last quick stories on COVID before going on to some other fun stories. There's been a few lawsuits that have been happening in the COVID sphere that haven't really been talked about, and we're just going to mention two of them real quick here. This first story comes from the Washington Examiner, and it is about a coalition of workers at the North Shore University healthcare system in Illinois, which filed a lawsuit in October of 2021 alleging that the healthcare facility was illegally refusing to grant religious exemptions to the mandate. That group of nearly 500 healthcare workers is slated to receive a $10 million payout in the first of its kind settlement challenging hospital COVID-19 vaccine mandates. Anybody who lost a job due to their inability to comply with the mandate is eligible to receive $25,000, and any of the 13 plaintiffs involved in the suit are eligible for an additional $20,000, meaning they would receive $45,000 in total. Now, workers who eventually received the vaccine despite raising religious objections would be eligible for around $3,000 in compensation. This is really great news, and in January, I was saying that this is going to be the year of the lawsuit, and I still think that's true. They're not going to be talked about much in the news, but I think a bunch of lawsuits that are in the system right now are going to come out favorably for those opposing the COVID mandates. One of the lawsuits that we're going to follow here on this channel is that of Dr. Mary Bowden, and she was suspended for vaccine misinformation. She was suspended from Methodist Hospital. Well, now she is suing for $25 million in a defamation lawsuit against the hospital. Now, we broke that story back in November of 2021, and back then, Dr. Bowden had all the goods. She had all the data. She was treating patients in her practice for COVID and has done so successfully before and since then. I think she has all the goods to win again, and I think she will win again. So we're going to let you guys know about this story as it develops. Now we've got a couple of stories on climate change real quick. Now I will dive into climate change in much more detail, I think, in a few weeks. I'm preparing a project for this next coming Friday that's going to be pretty intense and pretty intensely researched, not about climate change, but we will do a climate change episode, all climate change, in a few weeks probably. But this first story comes from CNBC, and the title of the story is "The Earth Spun Faster Than Usual on June 29th and Triggered Climate Anxiety. Here's how to cope." Oh boy. So the article starts off by saying the Earth shaved 1.59 milliseconds off its rotation on June 29, 2022, and that became the shortest day recorded since accurate daily measurements using atomic clocks first began in the 1960s. The article then follows, "It's unclear what accounts for the change, but scientists have predictions about potential causes like changes in weather systems, major earthquakes, melting ice caps, and much more." So by unclear, they have no idea. Got it. Okay. So then for many, these new findings, coupled with the severe heat wave we've been experiencing around the world and the extreme flooding in Kentucky and Missouri, are triggering feelings of climate anxiety. Well, what's that? Luckily for us, they define it. Climate anxiety is a state of heightened anxiousness, which can include feelings of guilt, grief, and desperation about the state of the environment, according to earth.org. Thankfully, there are psychologists who devote time to helping people cope with the fear that comes with the planet's changes. So actually, I'm going to stop reading this article because I can't take the seriousness with which this article takes itself. It is actually hilarious. But, they are being serious, and people really are getting anxious about the climate. Here's another story from CBS discussing how climate change is a cause of obesity in children.
A new study showing how climate change, specifically higher temperatures, is making our children more inactive and more obese. The study published in journal Temperature found today's children are 30% less aerobically fit than their parents were at their age. Fewer children are reaching the World Health Organization's recommendation of 60 minutes of exercise a day. Now, listen, it has been a lot hotter, and the weather has been crazy. But I think it also has to do with technology, Yeah. It's one thing not to go outside, but these kids don't go outside because they can stay inside and be on their phones, play video games, and be social without having to go outside and be social.
Even this reporter can't toe the line. He gets through what he's supposed to read. He talks about the climate change and obesity, and then he says, you know what? Maybe it's actually something more reasonable, like the fact that we have technology and kids can be social inside and play video games. That's a way more reasonable and actionable conclusion. If your kid is playing too many video games inside the house, you can act on that. You can turn the video games off. You can hide them away. You can make him go outside and play with friends. If the reason that they're obese is because climate change, which is a very nebulous term, can mean whatever you want it to mean, and you can't really impact it as an individual, well then how are you supposed to save your kid from obesity? If you don't want him to be obese, how else can you fight it if you were to take this premise? You can't. You can handle the video game premise, you can work on that as an individual, you cannot do the same with climate change. Also, they would really have to explain how kids are playing in like Texas right now. You're seeing heat waves in New England and in the UK a couple of weeks ago, but those heat waves are, a Texas summer. Now, I'm not saying that those environments are built for that, just like the Houston environment wasn't built to be frozen over. But the fact that kids are playing around all over the equator when it gets really hot is, a little bit of evidence that heat and climate change alone probably doesn't influence kids playing outside to the point of causing obesity. But again, I'm going to do a big episode on climate change in a few weeks. We'll break down a bunch of data. We'll talk about a bunch of policies. And, I'll let you guys decide what you want with the information. But suffice to say, real quick, those are my thoughts on these two stories. Now, one story real quick, kind of related to climate change. It's kind of a fun story, but it's been bugging me a little bit, pun intended. And I don't really have that much time to go into a full explanation. But what I have to say is I've been seeing a lot of articles related to eating bugs and climate change. My thoughts on that are really simple. Do not eat bugs to save the climate. That's it. Now, me personally, I think bugs are pretty gross to eat, so I'm not going to eat them. I'm not disparaging people in other countries that dine on bugs and have been doing so for their history. And on principle, if you're trying to survive in the woods or whatever, I have no problem with eating bugs there. My specific issue is eating bugs to save the environment. I'm not going to do it. I don't think there's the evidence to show that it will do that. But again, I'll break that down more in the climate change episode in a few weeks. But suffice to say, I am not going to eat bugs to save the environment, and I don't think you should either. And that's going to do it for us today, guys. Thank you so much for listening. Remember, at the end of next week, I'm going to be releasing a pretty contentious episode, I think, on the transgender debate, specifically surrounding transgender children. This topic is one that I'm particularly passionate about, and I'm going to lay out all the information, a lot of papers. I'm going to give you guys the tools and the resources you need to know about it and to know a lot about the science behind it and to form your own opinions. I think a lot of people are missing each other on the debate here, mostly because they're not informed. And so we'll walk through it. We'll look at a lot of data. I'm hoping that it brings about the ability, at least, to have some kind of conversation that's more substantial than name calling. I think this is clearly one of the biggest issues of our time, and I'm excited to dive into it. We'll see you guys next week. Please enjoy this video.